Good morning. I am Anusha as a nursing tutor at Emmanuel Arasar College of Nursing. I am going to present Inguinal canal and spermatic cord. Definition: it is a musculo-appendicitic tunnel about 4 cm in length and extends from deep inguinal ring to superficial inguinal ring. The canal is directed downward, forward, and medically above and parallel with the medial half of the inguinal ligament. Peculiarities: in female, the canal is narrow, hence the chances of inguinal hernia is less. Chance of inguinal hernia is less. In newborn, the canal is directed almost straight forward. Condensed spermatic cord in male and round ligament of uterus in female enter content ilioinguinal nerve. It enters the canal by piercing internal oblique muscles about 2.5 cm below and medial to anterior superior iliac spine. Posterior wall entirely formed by fascia transversalis, which separate the canal from the extraperitoneal tissue and peritoneum. It is partially formed by in medial half by the conjoined tendon in front of fascia transversalis. In medial 1/4 by reflected part of inguinal ligament in front of the inguinal ligament in front of the conjoined tendon. Floor formed by the crowd upper surface of inguinal ligament, the posterior margin of which fuses with fascia transversalis. Medically, the floor is formed by the upper surface of the lacunar ligament. Inlet formed by deep inguinal ring, which is an oval opening in the fascia transversalis about 1.25 cm above the mid-inguinal point. It is not an opening but is the neck of the internal spermatic fascia. Contents of the spermatic cord or round ligament enter the canal through the deep ring. Types of oblique inguinal hernia: between the superficial fascia and external oblique, between the external and internal oblique muscles, between the fascia transversalis and parietal peritoneum. Direct inguinal hernia: the hernia sac enters the canal through the inguinal triangle of Hesselbench. The neck of the sac in both varieties is medial to the inferior epigastric artery. It presents two varieties. Lateral variety when the sac enters through the medial inguinal fossa. Medial varieties when the sac enters through the supravesical fossa. Covering of lateral direct hernia: from within the outward peritoneum of sac, extraperitoneal tissue, fascia transversalis, cremasteric muscles and fascia, external spermatic fascia, Dotto's muscle and skin. Spermatic cord: the spermatic cord consists of a tubular sheath containing the vas deferens, vessels and nerves of the testis and epididymis. It extends from the deep inguinal rings to the upper part of the posterior border of testis and is about 7.5 cm long. During the descent, the spermatic cord receives 3 tubular coverings, prolongation from the abdominal wall. Coverings of spermatic cord: internal spermatic fascia from the fascia transversalis at the margin of the deep inguinal ring, cremasteric muscles and fascia from the internal oblique muscle, in external spermatic fascia from the openurus of external oblique at the margin of the superficial ring. The coverings of spermatic cord are continuous with the corresponding layer of the scrotum. Contents of spermatic cord: vas deferens passes along the posterior part of called fam infloin plexus of vein. Arteries, testicular artery, artery 2 vas deferens and cremastic artery, lymphatic from the testis and epididymis, drains into pre-aortic and lateral aortic lymph nodes, nerves, genital branch of genitofemoral nerve, cremastic muscle and testicular plexus of sympathetic nerves along the perivascular cord convey the fibers from T10 to T11. Loose connective tissue forms the bed for these structures and is continuous with the extraperitoneal tissue at the deep ring. Types of oblique inguinal hernia: vaginal, when the processus vaginalis remains potent along the entire extent, the hernia reaches the base of scrotum in front of testis. Funicular, the process vaginalis is obliterated above the testis and remains potent into the proximal part. Infantilis, a peritoneal sac is extended from the vaginal sac and high as the superficial ring. Interstitial, rarely a diverticulum of processus extends between the layer of developing abdominal wall in one of the following situations. Covering of complete types of oblique hernia from within the outward peritoneum of sac, extraperitoneal tissue, internal spermatic fascia, cremastic muscles and fascia, external spermatic fascia, dorsal muscles and skin. Oblique inguinal hernia. Oblique hernia, the hernia sac is performed due to persistent of process of vaginalis of peritoneum and the content enter the canal through the deep ring. Complete hernia, the hernia reaches the scrotum through the superficial ring. The neck of hernia sac lies lateral to the inferior epigastric artery. Development of inguinal hernia. Inguinal hernia, protrusion of any abdominal content covered by a sac of peritoneum is entered the inguinal canal abnormally. The content of hernia sac vary from the piece of omentum to small or large cut. When Michael diverticulums enter the scaneal sac like little hernia. So oblique and direct. Difference mechanism of inguinal hernia: flap valve mechanism, shutter mechanism, stability provided to the inlet outlet of inguinal hernia, ball valve actions, boundaries of superficial rings, base, apex, medically and laterally. Outlet is formed by superficial inguinal ring which is oblique triangular gap into aponeurosis of external oblique above and lateral to the pubic crest. Relation of deep ring or inlet above or in front and laterally medically. Thank you.